You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this episode, Victoria Young, volunteer and patient of the International Community Health Services Community Health Center in Seattle, Washington, shares her story and experiences touching on the benefits of enabling services and how it can be the bridge between community outreach and the clinical experience.
Thank you for welcoming me here today. My name is Victoria Young, and I am here today as living proof of the difference that ICHS can make in the lives of young people by providing the much-needed enabling services that we have just talked about. How do I know this? I have been directly impacted by ICHS's involvement with young people and the enabling services that ICHS provides, as I was a peer health educator in ICHS's API Girls Group at Franklin High School, and later became an ICHS patient. When I was a junior at Franklin, I was approached by the leaders of ICHS's API Girls Peer Education Group to become a peer educator. I can safely say that my involvement in this group was one of the best things about my high school experience. I feel that I have educated and helped the Asian Pacific Islander and teenage communities at Franklin High School by talking about reproductive health. I helped to create up-to-date presentations that were specifically designed to promote awareness among teenagers of sexually transmitted diseases and contraception, and the cycle of dating violence and its strong presence in the API community. If it wasn't for ICHS, many of my peers would not know as much about reproductive health because our teachers were not required to teach us to prevent teen pregnancy and STDs. It was empowering for me to be there for my friends who did not feel comfortable talking to their parents or other adults about their health questions. I have also gained strong leadership skills from my experiences as an ICHS peer educator. In school, I gave speeches and presentations where I learned to solve problems and feel comfortable speaking in front of groups of my peers and adults as I am doing today. I was also able to connect with Pia Sampaga, the ICHS Family Planning Health Educator, who is the leader of the ICHS Girls Group. Pia has been a personal mentor to me and has helped me with scholarships as well as life in general. Although I am no longer a peer educator because I am in college, I am still able to go to PIA for clinic-based enabling services and help as a patient at ICHS's Young Adult Clinic. Having been dependent on my parents for handling all my healthcare needs all my life, I felt fortunate to be able to utilize ICHS's enabling services on my own and with ease once moving out from home. Although I did not initially know what exactly I was supposed to do in order to reapply and renew my Take Charge benefits, I took it as an educational opportunity to learn about how I can be more accountable for my own health. I went to PIA and the other family planning staff at ICHS who guided me and were there with me through the entire application process. They explained everything, from why I had to fill out forms to how I would go about getting all the advantages I could out of my Take Charge coupon. This encouraging approach of cooperation made me feel more comfortable and confident in looking out for my own health. Being enabled to learn more about how to take care of myself with the support from ICHS has taught me that healthcare can be accessible and does not have to be something that people struggle with, as long as the right assistance and education is provided, such is the case with enabling services. And while not entirely related to enabling services, my work with ICHS inspired me to become a community advocate. Beyond just writing advocacy letters to our current representatives in King County asking for more funding for school-based health clinics, I was also able to attend a conference in Washington, D.C., aside from this one, where I lobbied for international family planning services with Congressman Dave Reichert and Senator Patty Murray. Because of my experiences with ICHS as a peer health educator and the enabling services that I received, I was well equipped to share my knowledge of public health, to use my advocacy skills to successfully lobby at the national level, and to continue to remain committed to promoting more accessibility to healthcare for everyone.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org. apcho.org.